This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about 5 possible reasons for knee pain. If you like this video, we put out new content weekly, so please like and subscribe. So there's more than 5 things that can cause pain inside the knee, but these are some of the 5 most common causes. Number 1 would be something called Patelfemoral Syndrome. So your kneecap rides in a groove along your femur or your thigh bone, and sometimes for whatever reason that can kind of get off kilter, and the kneecap will start being kind of pulled to the outside of the knee. So when that happens, there might not be any structural damage, and MRI might even come back normal, but the pain is kind of in the front of the knee, and that would be something called Patelfemoral Syndrome. The solution to that is just a lot of physical therapy to kind of get that kneecap fixed appropriately. If it's really bad in some instances and it's structural, then sometimes surgeries can be done to move the kneecap around, or something called a lateral release, where you release some of the capsular attachments to the outside of the knee, and that helps it move appropriately. But by and large, most people can get rid of it with physical therapy. Another reason you might have knee pain is you did some cartilage damage. Now, the process of continuous cartilage damage is what we term as arthritis, or I shouldn't say continuous, but accumulative. But sometimes if you're younger, you can just tweak your knee wrong, the cartilage gets dinged, dumps a bunch of fluid, the cartilage contains a lot of fluid, and that causes a lot of knee swelling. Usually that will kind of go away on its own if it's just an isolated cartilage incident, unless it's a big chunk of cartilage missing, in which case you'll have continued symptoms. But by and large, for most people, it gets better on its own. If it doesn't, then it's kind of a different story of what you do about that. But a lot of times when someone tweaks their knee and it's all swollen, that's a lot of what they did. Third is a meniscus injury. So the menisci are these kind of two shock absorbers basically you have inside your knee. You have 2 of them in each knee, one on the inside and one on the outside. And sometimes those can get torn. It'll kind of hurt sometimes when you walk. Any sort of twisting movement will cause pain. Sometimes these tears can become stable where they really don't hurt anymore, even though they're torn. But sometimes if they're really torn and they're continuing to cause pain, the solution, that's kind of where you get a knee scope and then just clean out that tear. Sometimes you'll be able to repair it. It just depends on where it is. But that's kind of pain more towards the side of the knee that hurts with twisting activities. So if you have that, you may have a meniscal injury. Another reason that someone can have knee pain is if they have arthritis in their knee. So this is common as you get older. You may see it sometimes in younger people as well. That'll be kind of pain that just hurts when you get up and you in the morning, and then it'll hurt more with activity. Real easy way to tell if you have that is just to get a standing x-ray of your knee. You want to get it standing, because if you don't get it standing, it's very easy to miss arthritis that still might be present. Treatment for knee arthritis, injections can kind of stem it for a while, but ultimately if it's terrible pain and you can't live with it anymore, then you're looking at a knee replacement, which generally does pretty well. And the 5th reason we have most common cause of knee pain is like a ligamentous type injury. This is when you're talking about like ACL tears. If you tear your ACL, usually you know about it. Your knee becomes swollen and it becomes unstable. There's other ligaments too. You have the lateral collateral ligament and the medial collateral ligament. And there's posterior lateral corner and all sorts of other small ligaments. But by and large, if you have a ligament injury, your knee will be unstable. Sometimes you can rehab it with just time and physical therapy. If it's still unstable after that, then you might need ligament reconstruction. So I hope I was able to answer your questions about some of the most common causes of knee pain. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond, but I can't give you medical advice over YouTube. And if you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.